morning, John. Thank you very much for joining us.
Pleased to meet you, Dan.
Now, you were just giving your presentation on stage, one of the keynote speeches of the day. It was essentially with the title of standards and data compliance, but really that wasn't the ultimate story. That was more, as we were saying just before, a means to an end.
Absolutely right. I mean, data standards are really important in optimising supply chain, but my message really is that we have a crisis looming here. We have an economic crisis, that health budgets are flatlining, and then we have to find ways of reducing costs in the NHS, the English NHS. And traditional approaches are not really doing it, and we need to look long and hard at the relationships with our suppliers to think about how we can take costs out of the supply chain.
And really this is very much a mutual thing, and it has to be a mutual thing to make it work on all sides.
Absolutely, and I've said this before, that the relationship between industry and the NHS, mainly because of the way we do our procurement, has meant that we've never really sat down and talked about how we take costs out collectively. And the traditional function in the NHS of procurement, and the professionals don't really understand how to do this themselves. So there's a real issue here that a lot of the expertise lies within the industry, and that somehow we've got to build a relationship so that expertise gets used by the NHS, because that's the only way we can do this together.
So to some degree, it's almost taking the best areas of the private sector, trying to bring them in without quote-unquote privatising the NHS?
I think just basically it is about the relationship, and for too long, we've gone through processes in procurement that using EU processes that put industry at arm's length, and in actual fact, I don't think we even understand what the possibilities and opportunities are. So it could be just as simple as getting in a room and agreeing on a new way of doing it, quite honestly.
Couldn't data standards, in fact, be that harmonisation route? I
think as we try and understand how to optimise supply chains, people will understand and realise that the data standards are at the heart of it. At the moment, we're trying to impose data standards on the NHS, but if you talk to a chief executive of a hospital about we want to mandate, for example, the use of GS1 coding, they are just haven't got a clue what you're talking about. So, we have to try and educate them about what this is all about. The bigger strategy actually is about reducing cost in the supply chain. Then they will understand that. Then they'll understand the reason for data standardisation.
The moment you essentially give the carrot on a stick of saying, well, your hospital will have more money if you fall into line with GS1 standards.
That's exactly right. And what I was saying in my presentation was that unless we really tackle this, I think a lot of hospitals will find themselves in a position where they're having to think about cutting frontline services, and that's not palatable. That we really want to do things that actually, if there is waste in the supply chain, why are we not working on that? And why are hospitals not working on that? And if they don't work on it and they suddenly find themselves having to cut clinical staff, that really is just not acceptable.
Of course. So and hopefully industry will see that and it should be in their advantage as well, surely.
I think it is. I think it's pretty obvious that the demanding customer, and again, listening to some of the other presentations today, it's pretty obvious to me the demanding customer has asked for so many things that actually it's become really expensive for industry in terms of things like consigned stock that they equally now can no longer afford. So it is absolutely in the interest of industry as well.
At this point in time, as you said, economic crisis, there's less money to go round, but more demand. We need to find that there has to be a break somewhere. And I know you were talking about incentives to cost saving. What kind of incentives can the NHS bring?
Well, I mean, it's a good question, and one of the things I'm really struggling with is that if we could figure out ways to optimise those supply chains and take cost out, we've got to figure out a way that then gets back into the health budget, and that's the difficult bit, and I still haven't kind of figured out really how to do that. The problem is that people start to try and focus on prices. The assumption is lower prices for products coming from industry results in savings for the NHS, which it does. Let's not get away from that. But that's not really going to achieve the strong relationship that we need. So we've got to find another way of releasing cost that both industry can benefit from and the NHS can benefit from. I have to say, I don't have a solution for that, and that's why I need industry's help in developing that solution. And that has to be done, within the context of a European public procurement regime as well. And that's the real challenge for it. I think everybody agrees we need to do it. It's the kind of how, really, that's the difficult bit.
And are there any particular timelines you have in place for that, or?
Well, as I said in my presentation, I think it's such a beast, this, and medical device industry is a huge area of expenditure for the NHS. that you can't do everything overnight. Which is why I focus purely on the orthopaedics. And the reason I focus on orthopaedics is because the clinical data is actually becoming pretty transparent, interestingly enough, because of our National Joint Registry. So we've got the clinical argument starting to come out onto the table. What we need to do now is put the commercial argument with that. And by doing that, we can see incentives on both sides to make it happen.
And getting the right, I suppose, IT infrastructure is going to be a huge component of that.
I think our IT infrastructure is a difficult one because, from the work that was done by the National Audit Office and last year in the NHS, it's pretty clear that the NHS is behind the curve in terms of IT and technology for data management. So it's inevitable there's probably going to be some investment in this. But again, if you put me on the spot and ask me what that investment is, I don't know. And that's why I keep saying that industry know this. They know what it costs. They know what it's taking for them to do it. We need to learn from that, and we need to know what it is that we need to invest in.
Well, if we consider this an open invitation to industry, if people do want to get in touch with you and start getting around the table, how can they do so?
I want them more to get in touch with me. I want them to come and tell me how to do this. So it is absolutely open invitation. I've already started to engage, obviously, with the trade associations in the UK, such as the ABHI. But the problem with those associations, and this is a particular issue, when you're talking to senior folk in the companies, you are going through the sales route, so it's the sales director or the chief executive, and then you can't have this kind of conversation because that's not what they're experts in. The people in this room are experts in supply chain. And so it's the senior people in this room that I really want to talk to, quite honestly. So if there's any way that we could start to build some kind of meeting that would, we can have open discussion and dialogue, I think that would be fantastic.
Well, in which case, I better let you get back to it so you can indeed go and engage with those people.
Fantastic.
Thank you very much indeed.
Thank you. Cheers.